Dr. Vijay Agarwal. I'm a senior medical oncologist at HCG Hospital in Bengaluru. So immunotherapy is playing an increasing role in cancer care as we go forward. It's pretty much taken on board in the past 4 to 5 years, where most of the immunotherapy has developed in an extremely successful way. We always knew that some of the cancers were immunological. However, we didn't have effective immunotherapy back then. But now we have ways to augment the body's immune system to attack on the cancer cells. For example, cancer cells being our own body cells tells the immune system not to kill it by a particular pathway called PD-1 pathway. And now we have drugs which are called PD-1 inhibitors, which inhibits those pathways so that the body can now attack the cancer cells much more efficiently and deal with the cancers that have already spread to other parts of the body, which at this point in time is very, very difficult to cure. But immunotherapy clearly has the potential to provide long-term outcomes for these patients. There are again different types of immunotherapy. So immunotherapy itself is a broad terminology, and PD-1 inhibitors are only one of the types of immunotherapy. We can also take the body's immune cells, activate them outside the lab, and put it back in the patient to augment the immune system. And also there's a lot of increasing role of cancer vaccines which are now being developed pretty much under research protocols. And I think that will go a long way in terms of helping patients who are otherwise not curable in obtaining long-term survival. Yeah. So HCG is a highly developed immunotherapy department. So we have a department of cellular therapies. Pretty much we have a dedicated space allotted to immunotherapy called the iCrest, where a lot of the immunotherapy is developed in-house. So we provide all types of immunotherapy to our patients, right from drugs which are PD-1 inhibitors, which we can buy commercially and give it to our patients, and we have a lot of experience in doing that now. Previously we had to import those drugs, but nowadays, pretty much in the past, say 6-7 months, it's been available in India, and we've been using it routinely in lots of cancer patients. Particularly, it's been very, very effective in things like lung cancers, melanomas, kidney cancers, head and neck cancers. So it's shown an extremely beneficial effect in these cancers, and we are seeing that more and more common. Also, in our iCrest laboratory, we can extract the T cells from the patient's blood and then activate them outside and then put it back in the patient. Thereby, we call this an activated T cell lymphocyte infusion, which we've shown as to be quite beneficial, particularly when we give it to patients who are otherwise responding to treatment and to sustain those treatment. We can also create dendritic cell vaccines in our lab. So we can take a biopsy of the tissue, and based on that biopsy of the tissue, we can create customized vaccines which are specific for those individuals and give those vaccines to these patients. So a lot of this work is under experimental protocol, but we have seen some very, very good effect and long-term survival with these therapies. So I think we are at this point in time, I dare say, that leading the way forward in terms of immunotherapy in its whole package. And we're also looking at doing some research work to augment our own capabilities to ensure that we provide a holistic immunotherapy package at the best possible cost price. So currently, when we look at the drugs are quite expensive. So each dose of immunotherapy, the PD-1 inhibitors cost anything between 1.5 to 3 lakhs, and it has to be given about once or twice a month. So I agree that at this point in time, immunotherapy is expensive. But the issue is not the expense of the drug itself. I mean, if you look at overall cancer care, in India, the cancer care is about 1/5 or 1/6 of the price of the Western world. So we provide similar outcomes at 1/6 of the price. So the cancer care in India is already quite reasonable and economical. I think the issues we have is lack of insurance coverage for our patients. So for example, less than 30% of our patients have some sort of insurance, either that be public insurance or private insurance. And even if those patients who do have insurance, they have a cap on the limit of the insurance, which is actually quite small, which ranges from 2 to 5 lakhs. Rarely we get patients who have more than that coverage. And cancer care is expensive. In fact, there was a research done by King's College in London which says that cancer is one of the most expensive diseases to treat. And this is a worldwide problem, not an India-specific problem. So there's no denying that cancer care is expensive and the drugs are expensive. And one of the ways to make it affordable or deliverable is to ensure that we have a comprehensive insurance package, either through public insurance or private insurance, to ensure that the patients can afford these treatments. More importantly, education is very, very important because we know that when cancers are diagnosed early, It is much cheaper to treat as opposed to being diagnosed late. Also, we don't have access to clinical trials, early clinical trials that much compared to the Western world, where most of the treatment can be given free to the patient. So for example, a lot of immunotherapy trials are going on. We don't have access to those trials at this point in time, where these very good medicines can be given at free of cost to our patients. And I think trying to lobby to get more and more clinical trials to India, a lot of support from the government is required for that. And if we can get that, I think it will make a huge difference in how we can make these treatments affordable. The other types of immunotherapy, like the activated T-cell lymphocyte infusion, the dendritic cell vaccines and things, because they're done in-house, we are already providing one of the cheapest ways of delivering those immunotherapy techniques to our patients.